We seem to hear a lot from both sides. Epidurals are evil, epidurals are amazing. But today I want to tell you some little known benefits about the epidural that people don't talk about. These are ones that actually may be the reason why you need an epidural instead of just pain. But an epidural can be really helpful, and I'm excited to share these with you guys because nobody talks about them online.
Attention, attention. Paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
And when you're learning about an epidural, please learn from an expert. I just saw a manifester on TikTok talking about epidurals as though she was like a freaking anesthesiologist. Like, I flipped to her profile and it was all just about like manifesting a good birth. And that's so frustrating to me because an epidural is a complex topic, which you really need to understand. And it can be really hard to make the choice in the moment when you're in a lot of pain. So having the facts in advance can be really helpful. I'm so glad that you guys are here. And yes, this is from reading studies, seeing thousands of patients in the hospital and talking to millions of people online. It's good advice. Let's jump into those benefits. And yes, this is from an article on my website. I will go ahead and link that down below as well. And by the way, if you're all these people out there saying, why is she pushing the epidural so hard? I actually have a whole video on reasons to avoid the epidural. I really am here just to give you guys this facts because it's so hard to get information about an epidural ahead of time. That's what I'm here for. The biggest reason that people don't talk about, and it is rest. So a lot of you might have prodromal labor every night. I actually have a whole video about the roller coaster of emotions of thinking you're going into labor every night and then it peters out and it's nothing. I know exactly how you feel, and be sure and check out that video if that's you. But maybe, you've been laboring all day, well into the night, and you're just exhausted. And because you're a smart person who's here watching me on YouTube, that, rest is not going to get any better after baby is born. It is still going to be difficult to get the rest that you desperately need. And also, you've got 2 hours of pushing ahead of you once that cervix fully dilates. So filling up your gas tank with rest is a huge reason to get an epidural. And it's one of the big ones why when people are like, oh, I went all natural, and they're like, I only had a 4-hour labor. I'm like, of course you did. Like, that's so much different than people who have a 24-hour labor. And I know a lot of you guys are thinking, oh, that's only for an induction. But a lot of people are uncomfortable and unable to rest for hours before the baby is born. And so if you're exhausted, an epidural can be huge to get that nap in. Pro tip, I love a well-dosed epidural in the beginning so that you are numb and can get a great nap. Now, I'm a huge fan of movement, but if you can sleep, that's always the king of labor and delivery, or honestly, the queen. Why is it the king? Rest is a big reason. Don't fool yourself into thinking that rest isn't important because it's totally important. Of course, the other pro tip is once you get that nap in, you can actually tailor your epidural to help you move a little bit in bed so that you can use movement along with rest during your labor. I have that whole video. I'm going to link it down below about customizing your epidural. Okay, this is one not a lot of people talk about because the converse can be true as well. But a lot of people are really worried about peeing post-epidural. But personally, the people that I've seen the hardest time peeing after an epidural is people who got lidocaine from tearing or an episiotomy at delivery because it really numbs those nerves versus an epidural where it slowly wears off. So peeing can be a benefit after an epidural. It can also be a risk, but I see so often people are like, oh, you can't pee after an epidural, but you also might not be able to pee after just a regular vaginal delivery, and especially if they give you lidocaine as baby's coming out. And lidocaine is just like what they give you in the dental chair or when you get stitched in, it just numbs that area. Side note, not being able to pee after delivery is not all that uncommon. And if you don't pee, there is a chance that you might bleed a little bit more. So your nurse is actually going to have tricks that they try with you. If you want a whole video on how to pee after delivery, tell me down in the comments. That would be a fun one to make. I can't believe I just said a video about peeing would be a fun one to make. I feel like I need to get out more, guys. Another benefit is decreased blood pressure. Now, when I started in labor and delivery, blood pressure was not like a huge deal. Again, remember it was in 2001, but blood pressure has become a huge deal in labor and delivery. There are so many patients being induced for preeclampsia or hypertension, aka high blood pressure, that if your blood pressure starts to go up because of the pain, We are just adding that on already increased blood pressure, which can cause issues with your heart. It can make you to stroke out. It's not a good thing. So if you're in pain and your blood pressure starts to go up, yes, there are medications that we can give you, but sometimes that's like fighting a losing battle, whereas just relieving your pain may be the key to lowering that blood pressure safely. I just want you to know it's one of the tools in our toolkit to help that blood pressure come down because it is important. And I want you to take blood pressure really seriously. Yes, sometimes you get one high reading in the office and then it comes down, but far too often we're sort of ignoring blood pressure because you're young and healthy. And that's not the case in labor and delivery. I want you to be taking it seriously, asking your provider about what the next step are with blood pressure. That's just Hilary getting out here. And if you're early on in pregnancy, please talk to your provider about taking aspirin during pregnancy because it has been shown to have benefits for blood pressure and preeclampsia. Huge fan, talk with your provider. And I have a whole video on preeclampsia here on YouTube. If you want more information about that, I'll link that one down below as well. Okay, here's another weird one, but we're talking about pee again. It is not having to pee. So when you get an epidural, most often we insert a catheter. Now, there's two different kinds of catheters, one that goes in and comes out and one that goes in and stays there. And you can kind of decide which one works for you. That's not what this video is about. If you want a video about that, tell me down below. But so many people love the fact that they do not have to get up and pee. That nap after the epidural is some of the best sleep you've had during your pregnancy because you don't have to get up and pee. That Foley catheter is doing the work for you. And on videos that I post about the catheter, I have so many people saying, oh my gosh, that's horrible. Why would you put a tube up there? And then I have these other people who are like, I absolutely loved mine because I didn't have to get up and pee. Now, you can get a catheter without an epidural, but it is a little bit more uncomfortable. So it's just one of the benefits of the epidural. You get that catheter, but you don't have to feel it. Most people don't even know what's in there. It's a big win. And the last one is that it helps your body to relax. Now, if you've watched many of my videos over here on the YouTube, you know that this uterus is surrounded by your pelvic floor. And they are big muscles. And if your whole body is tensed up because you are in pain, which is this is exactly how I look when I'm in pain, that pelvic floor is going to be tensed up too. And as you can imagine, it's not going to leave much room for the cervix to open up or to let that baby descend into the birth canal. So being able to relax can be a huge thing. In fact, oftentimes if we have patients who are going natural or without an epidural and we're just noticing that they're not progressing, sometimes we will offer them an epidural to help them to relax. And I've seen time and time again that helps this pelvic floor just relax and the baby's able to descend. It's crazy. Again, a lot of times we hook a nap into that, which is a great time to relax because your whole body relaxes at that point. So if you are going unmedicated, say you don't have an epidural and things just are not progressing, I want you to think maybe I should get an epidural. Maybe it will help me to relax because I've seen time and time again that can really help. And I hear people online saying the epidural slows down labor. And I will say, if you watch my video on reasons not to get the epidural, that is true. But the converse is true too. For some people, it helps speed it up. And for some people, it slow it down. But I really think that if you're like in a good active labor pattern, it doesn't really slow it down much, maybe a few minutes, but is well worth it to avoid a C-section possibly. And this is the time when I remind you that I think it is so important that everyone, people who want an epidural, people who don't want an epidural, learn some natural pain management techniques. That includes breathing, massage, ways your partner can help. So important. I actually have a birth class that I recommend that goes through that. It talks about the epidural, but it also talks about natural pain management. And I think everybody needs both sides of that coin so that you can make the right choice for you when you are in labor. And I especially recommend that you get that partner involved, make sure that they understand natural pain management and how to help you cope, but also how the epidural works so that they're not freaked out if you end up getting an epidural. I'll link the class that I recommend down below. And finally, I'm here to tell you that you cannot say, well, Sally down the road did it without an epidural. Why can't I? That's just not how life is. We have no idea what Sally's labor is. We honestly don't know if she's lying, if she got an epidural or not. You just cannot compare two different labors. You have to be able to make the choice while you're in labor about what's best for you right then. And again, a good birth class is going to help you to make those choices in the time that it happens. A bad birth class is going to tell you just to avoid an epidural because that is not the case either. Remember, the epidural and natural pain management techniques have been proven to be safe in labor. So both of these are safe things that you can use, and then you make the choice about what's right for you, because the choice is not the same for everyone. I get a ton of questions about the epidural, which I love you guys asking. I actually have a whole video about some of the most frequently asked questions about the epidural. I'm going to link to it up above. I hope you appreciated these little known benefits about the epidural. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.